On-the-scene video coverage of TCT 2012 is supported by Pradaxa.
So, Dr. Block, FAME2 cost-effectiveness results.
Well, the FAME trials, Roger, as you know, were trials that tried to figure out whether or not FFR-guided percutaneous coronary interventions, that is stenting for people with angina, was useful or not, and whether it improved outcomes over optimal medical therapy. And I won't go into the details of the two trials, FAME1 and FAME2. The bottom line is that if you do FFR-guided therapy, patients do better in terms of symptoms and in terms of recurrent events. That's a sort of a broad brush view of what those trials showed. Now we have the question raised, well, okay, if it's better to do FFR-guided stenting, is the cost worth the benefit? And these data are now out, and we'll have an answer to that. And the answer, frankly, is that at the front end, it costs more to do an FFR-guided stenting procedure than it does to do optimal medical therapy. It's sort of a duh kind of answer because, of course, you have to pay for the stent, you have to pay for an intervention, and you have to pay for the FFR and so forth. So no surprise, the cost at the front end for patients who have FFR-guided stenting is higher.
And over time?
Well, that's the interesting thing because after the first year, there's a 50% reduction in the cost difference. And that cost difference, of course, is the major difference between the optimal medical therapy and FFR-guided PCI. And if you can cut it in half in 1 year, we don't know what's going to happen over the next years because this is a relatively short-term trial. So we'll see what happens to the costs going forward. But then again, it makes sense. If you have optimal medical therapy rather than an FFR-guided stent, the stent takes away your symptoms. You don't come back for another PCI. You don't come back because you're having an infarct. Whereas optimal medical therapy, because it has a higher recurrent event rate, causes you to come back to the hospital more frequently. So over the next year, you cost more in the optimal medical therapy group, and that differential decreases between the two groups. We'll see how it goes going forward. It will be an important follow-up in the next year.